Safeguarding is the broader responsibility of promoting welfare and preventing harm, while child protection applies when there is a risk of significant harm to a child. This distinction is important because it changes the level of urgency and the response required. In practice, child protection rarely begins with a clear or obvious incident. It often starts with small changes in behaviour, presentation, or routine. These early indicators may seem minor in isolation, but they become significant when they form patterns over time. Practitioners play a key role in recognizing these early signs. Acting early, even when information is incomplete, is often what prevents harm from escalating. Practitioner Responsibility. In child protection, practitioners are not responsible for investigating or proving harm. Their role is to notice concerns, record them accurately, share them appropriately, and escalate when necessary. Professional curiosity is an essential part of this process. It involves being willing to question what does not feel right, seek context, and avoid accepting explanations too quickly. A common challenge in safeguarding is hesitation. Practitioners may feel unsure or worry about getting it wrong. However, safe practice is based on acting on reasonable concern rather than waiting for certainty. Recognizing abuse and neglect. Recognizing abuse and neglect is not about identifying a single clear sign. It is about understanding patterns, context, and change over time. Neglect is one of the most common forms of harm, but it is often missed because it develops gradually and can become normalized. Other forms of abuse, including physical, emotional, sexual, and domestic abuse, may present through a combination of behavioral, emotional, and environmental indicators. Practitioners must remain observant and consider how different pieces of information connect. Behavior is often a form of communication, and changes in behavior can signal underlying risk. Disclosure and response. Disclosures can happen in different ways. A child may speak directly, indirectly, or communicate through behaviour. Sometimes disclosures are partial or develop over time. The most important response is to remain calm, listen carefully, and avoid interrupting or leading the child. Strong emotional reactions can make a child withdraw or stop sharing. It is important not to promise confidentiality. Instead, practitioners should explain that information may need to be shared to keep the child safe. After a disclosure, information should be recorded clearly and passed on through the appropriate safeguarding process, while maintaining a calm and stable environment for the child. Recording and information sharing. Accurate recording is a critical part of safeguarding. It helps build a clear timeline of concerns and supports effective decision-making. Records should be factual, clear, and completed as soon as possible. They should include what was said, what was observed, the context, and any actions taken. Practitioners should avoid assumptions or conclusions and focus on recording information accurately. Information sharing is essential in safeguarding. Concerns should be shared appropriately and without delay, as holding information back can increase risk. Multi-agency working. Child protection relies on multiple professionals working together. No single practitioner or service holds the full picture of a child's life. Small concerns observed in different settings may not appear significant on their own, but when combined, they can indicate serious risk. Practitioners must share information and avoid assuming that others are already aware. Clear, factual communication helps other professionals understand concerns and respond appropriately. Effective multi-agency working improves outcomes and reduces the likelihood of risk being missed. Thresholds and decision-making. Thresholds are used to determine when a concern requires further action. These range from early help through to child protection intervention. One of the challenges in safeguarding is that decisions are often made with incomplete information. Practitioners may not have a full picture and may need to rely on professional judgment. Patterns and changes over time are key indicators of increasing risk. A single concern may not meet a threshold, but repeated concerns may. A helpful shift in thinking is to act on concern rather than waiting for certainty. Early action supports safer outcomes. Safeguarding referrals. A safeguarding referral is a structured way of sharing concern with appropriate services. It is not a decision about outcome, but a step in the safeguarding process. Referrals allow information from different professionals to be brought together so that risk can be assessed more effectively. A strong referral includes clear, factual information, evidence of patterns, and, where possible, the child's own words. Once a referral is made, responsibility is shared with the receiving service. The role of the practitioner is to ensure the concern has been communicated clearly. Escalation and professional responsibility. Escalation is necessary when concerns remain unresolved or when the level of risk increases. It may involve challenging decisions or following formal safeguarding procedures. Escalation can feel difficult, particularly where hierarchy or confidence is a factor. However, it is a professional responsibility. Professional challenge should be calm, clear, and focused on the needs of the child. It is not about conflict, but about ensuring concerns are properly considered. Child safety must always take priority over discomfort, uncertainty, or organisational hierarchy. Applied judgment and reflection. Safeguarding practice involves uncertainty. Practitioners often need to make decisions without complete information. Changes in behaviour, mood, or engagement may indicate risk even when there is no disclosure. These situations require careful observation and thoughtful judgment. Practitioners must be willing to reflect on their decisions, consider different possibilities, and take appropriate action. Reflection supports learning and helps build professional confidence over time. Effective safeguarding is not about making perfect decisions. It is about making informed, thoughtful decisions that prioritize the safety and well-being of the child.